Acrophobia. Acrophobia is an extreme irrational fear or phobia of heights, especially when one is not particularly high up. It belongs to a category of specific phobias called space and motion discomfort that shares both similar causes and options for treatment. People with acrophobia can experience a panic attack in high places and become too agitated to get themselves down safely. Approximately 2 to 5% of the general population has acrophobia, with twice as many women as men. A possible explanation for acrophobia is that it emerges through accumulation of non-traumatic experiences of falling that are not memorable, but can influence behaviors in the future. A fear of falling, along with a fear of loud noise, is one of the most commonly suggested inborn or non-associative fears. If this fear is inherited, it is possible that people can get rid of it by frequent exposures of height in habitations. Ophidophobia. It is a particular type of specific phobia, the abnormal fear of snakes. It is sometimes called by more general term herpetophobia, or the fear of reptiles. The word comes from the Greek word ophis, meaning snake. About 1/3 of adult humans are ophidophobic, making this the most common reported fear. A 2001 study by Karolinska Institute in Sweden suggested that mammals may have innate negative reaction to snakes, which was vital for their survival as it allowed such threats to be identified immediately. Astrophobia. It is a fear of thunder and lightning. People with this phobia experience overwhelming feeling of fear when they encounter such weather-related phenomena. Symptoms of astrophobia is similar to those of other phobias and includes shivering, rapid heart rate, and increased respiration. During a thunder or lightning storm, people with this disorder may go to great lengths to take shelter or hide from the weather, evident hiding in beds under the covers or even ducking inside a closet or bedroom. People with this phobia also tend to develop an excessive preoccupation with the weather. Trypanophobia. It is the fear of injections, a condition that can sometimes cause to avoid medical treatment and doctors. Like many phobias, this fear often goes untreated because people avoid the triggering objects and situation. Estimates suggest that as many as 20% to 30% of adults are affected by this type of phobia. When people with this phobia do have to have an injection, they may experience feelings of extreme fear and elevated heart rate up to the procedure. Some people can even pass out during the injection. Social phobia, also known as social anxiety disorder. Social phobia involves the fear of social situations and can be quite disturbing. In many cases, these phobias can become so severe that people avoid events, places, and people who are likely to trigger an anxiety attack. People with this phobia fear being watched or humiliated in front of others. Even ordinary everyday tasks, such as eating a meal, can be anxiety-provoking. Social phobias often develop during puberty, can last throughout life unless they are treated. The most common form of social phobia is a fear of public speaking. In some cases, social phobias can cause people to avoid social situations, including school and work, which can have a major impact on the individual's well-being and ability to function.